Chapter 9. In this chapter, you will learn about various types of musculoskeletal injuries. Some of these conditions, such as contusions and hematomas, will be familiar to you, but others, such as myositis ossificans, may be unfamiliar. Please use the PowerPoints to guide you in your reading. Contusions are common injuries in athletics and are often referred to as a bruise. The discoloration is known as ecchymosis, which is a fancy word for black and blue. The initial treatment consists of the acronym RICE: 20 minutes of ice, the use of an ACE bandage for compression, elevation, and, if the athlete is limping, the use of crutches. A severe contusion can result in a hematoma, with a further complication known as myositis ossificans. Please refer to the next slide for additional information. A hematoma is known as a blood tumor. Instead of the blood dispersing throughout the tissues as in a contusion, the blood in a hematoma pools. As a result, the athlete will have a localized pooling of blood, as shown in this picture. Utilize the RICE approach, and if the hematoma is quite large and painful, refer the student athlete to a physician for possible aspiration of the blood. Using the textbook, identify the definitions, signs and symptoms, and treatment of sprains, strains, dislocations, subluxations, bursitis, tendinitis, delayed onset muscle soreness, and atrophy. Anytime a word ends in itis, as in the case of bursitis or tendinitis, that simply means inflammation. So bursitis would refer to inflammation of the bursa, and tendinitis would refer to inflammation of the tendon. Using the textbook, identify the mechanism of injury, treatment, and complications of the most common fractures. Examples of such conditions will be available on the next 5 slides. In sport, oftentimes medial tibial stress syndrome, also known as shin splints, will precede a stress fracture. To explain this in basic terms, the repetition and strength of the force is greater than the strength of the soft tissue and bone, causing a hairline or stress fracture. This fracture is not distinguishable on X-ray until healing has occurred. Therefore, bone scans, as seen in this slide, is the diagnostic procedure of choice. Notice the hot spot that is displayed on the left side of the X-ray. This is a stress fracture of the tibia. The treatment consists of rest and addressing the source of the problem, including flat feet, tight calves, overuse, and muscle weakness. If an athlete continues to play with a stress fracture, he or she may experience a complete fracture, which will be discussed in another section. Epiphyseal conditions refer to injuries to the growth plate. These growth plates are located at the end of the long bones in children and young people who haven't completed puberty. After the individual reaches puberty, the growth plates close and are replaced by solid bone. If a young student athlete sustains a joint injury, it is imperative that he or she seeks medical attention from a physician to rule out an injury to the growth plate. An undiagnosed injury could halt or inhibit growth. It is also important that young athletes never work through the pain and allow ample time for rest and recovery between athletic activity events. This is especially necessary for young pitchers, long-distance runners, and gymnasts. This chapter is now complete.